Health and social care staff are really important in shaping good care for people living with HIV. If they are not up to date with their good practices and knowledge, then they can lead to fear and stigma and the patient not accessing care or treatment. Outdated, harmful practices are things like isolating a patient in a room on their own because they feel they're infectious, deep cleaning a room when somebody living with HIV has left, and asking somebody how they acquired HIV. We hear stories about staff double gloving. If a health professional approaches a patient living with HIV with 2 pairs of gloves on, then that patient automatically feels as if they're putting the health professional in danger because they're perceived as being infectious and putting them at risk, and there's absolutely no need. When somebody is diagnosed, they are started on medication quite quickly. The way the medication works is to dampen down the virus and stop it replicating. That eventually means that they will become what's called undetectable. That means the virus is no longer at a level that it will attack the person's immune system. So it's still there, you can never get rid of HIV, but it is at a low enough level that it is undetectable. And what that means is that they are living with HIV, but they cannot pass on the virus. Good practice for caring for people living with HIV involves treating them as a person. It's really important that they are treated with the same respect and dignity that any patient who accesses any healthcare gets. Caring for people living with HIV poses no risk to any healthcare or social care staff member. If you are following standard infection control procedures, there is no risk. We have to ensure that people living with HIV access care and treatment and feel safe to do so in a stigma-free zone. HIV has been around for 40 years. We now have got access to so many effective treatments, and yet here we are, we're still talking about stigma. I think there's still a lot of work to be done to ensure that people living with HIV continue to access care and treatment. We all have a responsibility. If we don't challenge any bad practice, then things are never going to change.